Good morning students, you will see about physiotherapy management in the fracture cases. In the treatment of fractures, it is very important to restore the full function of the limb as well as that of the person in the shortest possible time. The common disabilities at the end of the fractures, treatment of muscle wasting, joint stiffness, and this has been aptly named fracture disease. Even when the plaster is done, the patients are made to attend the physiotherapy department and taught the exercises for the joint which are free. When the plaster is removed, the muscle strength is built up by graduated exercise and the joints are mobilized by active and active assisted exercise. Duration of the immobilization. In the children, the upper limb fracture you need the 3 to 4 weeks. In the lower limb fracture you need the 6 to 8 weeks. In adult, the upper limb fracture you need the 6 to 8 weeks. The lower limb fracture you need the 12 to 16 weeks. Physiotherapy management, identification of the nature of injury, physical assessment, planning of treatment and a home program. Immobilization phase, during the treatment of controlling the inflammation, pain, edema, that is a control of the treatment. Then checking the immobilization, then proper positioning of the fractured limb, then improve circulation by exercise, strong isometrics, then general body mobilization exercise. Then mobilization phase started to inspection of the fracture site, then mobilization of the joint, then re-education of the correct pattern of the movement. In the mobilization phase, you will do it the first will where it is inspected. You will show the X-ray findings. You will show the X-ray findings. Any changes, gastric changes, healing of the callus formation. These are the check out the X-ray finding. Then we will move on the next set of the exercise. In case of the callus formation not united, it will wait for the mobilization phase. Then we will go through the same immobilization phases, continuing the set of the exercise. Once the callus formation is attained, then we will move to the next phase of the exercise. Okay, so avoid of the break in the bone. That is the main complication of the phase fractures. In the immobilization phase, same for the X-ray findings. We'll check out the X-ray findings. Any the bleeding, start and the suture side the bleeding, then the infections. These are avoided of the main complications. Then for the control the pain, inflammations. These are the main inflammation. Then check for immobilization. How to check immobilization? The proper positioning of the fractured limb. Then avoid external rotation of the limbs. Then improve circulatory disease. Prolonged bedridden patients mainly for the exercise for the circulatory disease, ankle pump exercise will mainly do it for the exercise. That is improved circulatory exercise. And then strong isometrics. The strong isometrics is mainly useful for the muscle avoid of the muscle wastings. So the contraction, only the muscle tension is created, not movement, only tension created. So muscle maintain the muscle tone. That's useful for strong isometric exercise. Then general body immobilization. General body immobilization exercise, that is the breathing exercise. Breathing exercise is also train the patients. That is the residual capacity is maintained or increase the patients. So helpful for the in the mobilization phases. That is a set of the exercise. This set of exercise is properly trained for the patient. Then next technique of the mobilization phase to easily to take care of the patient in the mobilization phase. That is mobilization of the joint. What of the joint is mobilization first? All of the joint is the elbow joint, a knee joint, a shoulder joint. All of the joint inspected. Then where is a fracture is the present. That kind of the joint is properly teach the patient. Okay. Then re-education of the correct pattern of the movement. Mainly for summarize how is the fracture management? That fracture is a limb is shortest discontinuous bone is a fracture. And even for builder some children take time 3 to 4 weeks, lower limb 6 to 8 weeks, and adult is 6 to 8 weeks, lower limb for 12 to 18 weeks. Mainly from ultimate goal of the physiotherapy management is the three part. One is the identification of the nature of injury, what of the injuries, that is the identification. Okay, then physical assessment. Any cases will find out the assessment. Assessment is a must important for physiotherapy. Then you will go for that assessment. You will go for this plan of treatment. Okay, short term goal and long term. Short term goal is mainly for pain reduced, inflammation reduced, edema reduced. Okay, then you will go for long term goal. You will go for range of motion exercise, then functional activities, then reach the sports recreational activities, then home program. All of the research of the patient, the hospitalization, you will do it for home program or active exercise, self voluntarily do it the exercise.